titles up and running shortly. I'm going to introduce you to your chair for this evening, Ian Watkinson. So thank you very much. Cheers.
Thanks very much for that. Good evening, colleagues. Thanks for joining us. My name is Ian Watkinson and I'm the NEU's National Executive Chair of our National Health and Safety Organising Forum, and it's my pleasure to be chairing today's online rally. I was going to say that the chat function will be open throughout the meeting, but the guys are working on it. It might be that you can post in the Q&A function. Hopefully we'll see useful information and links posted wherever it is, along with our NEU meeting code of conduct throughout the meeting. And if you do have any questions or comments, we'll try to deal with those throughout the chat, or through the chat function or the Q&A function. Colleagues, on April 28th each year, the trade union movement around the world unites in solidarity to mark International Workers' Memorial Day. We remember all those who've lost their lives at work or because of work, and we resolve to fight to prevent more deaths, injuries and disease as a result of work. The theme for the day is a fundamental right to safe and healthy work. And colleagues, this year, the call to remember the dead and fight for the living has never been so relevant and urgent. Over the past year, thousands of workers, including many of our colleagues in education, have died from COVID-19. We will never know the true number because many weren't tested, hospitalised or recorded and reported as work-related infections and deaths. And we will likely never know the true number who died needlessly as a result of appalling government failures to prevent the spread of infection and protect education workers or the school and college communities they served. We've got some brilliant speakers this evening, including our Joint General Secretary, Kevin Courtney, Scientist and Senior Lecturer in Clinical Epidemiology, Deepti Gurdasani, and National Health and Safety Campaigner and Spokesperson, Janet Newsham from the fabulous Hazards Campaign Group. We'll also be hearing later from some of our health and safety reps with some examples of how their actions as safety reps have made their schools and colleges and communities safer and helped save lives. But before we hear from our first speaker, we'd first like to share a short video highlighting just some of the things that you've all achieved and been part of since the pandemic began. Thanks. Thanks very much for that. Brilliant video, and it just highlights what an incredible amount of work has gone on and what has been achieved by our health and safety reps, advisors, workplace reps, COVID reps, officers, staff, members and activists since last year's International Workers' Memorial Day. Not forgetting, of course, that all this life-saving work took place under the leadership of our Joint General Secretaries, Mary Bowstead, and our first speaker, Kevin Courtney. Kevin.
Thank you very much, Ian. And thanks to the health and safety officers in the union, the Health and Safety Officers Organising Forum worked to get tonight together for us. And I hope everyone on the call enjoyed that video. It's possible to look at that and think that it's a record of work that's done by people in head office. And people in head office have done a lot of things, but all of that is a record of the work that has been done by thousands of workplace reps, of COVID reps, of health and safety reps, people who step forward in order to make a real contribution, and in doing that, have kept some people alive who would have died, have stopped some people getting long COVID who would have got long COVID. We haven't managed to do everything. You work in a context with a government, but when you go back to that video and you think about the things that we did together, that more or less a year ago, when we called for schools to close and we said that CEV and CV people should work from home, that was a very big statement. That video was seen more than 1 million times. And we know that reps started working then, protecting those members who were most at risk from the virus by getting them working from home, then working on making sure the rotas happened in schools so that NHS workers could carry on being in schools. And you may remember, it's hard sometimes to go through all this, the DT teachers who started making masks because our country, for health workers, because our country just didn't have the PPE available. We did that in March. In June, the pressure around the 5 tests actually was part of pressure on the government about getting testing set up. Then health and safety workplace reps worked with head teachers to get those checklists in place, and head teachers saw that they couldn't open on the 1st of June because of the pressure of getting those checklists sorted, and we got those sorts of phasings which mattered in terms of cases falling that bit further. Then, goodness, if only the government had listened to what we'd said from the National Education Union in our education recovery plan in the summer, that they should have been organising those extra teaching spaces to reduce class sizes, so to work with rotas so that we didn't have the increase in cases we saw through the autumn term. And my goodness, I want to say again, if they'd done what we said, and if they had followed us when we said there should be a 2-week circuit break at half term, including schools, they failed to do that. If they had done what we said and put schools in the lockdown in November, then we would have missed a lot more deaths this year than we've had. There would have been less disruption of education if they had followed what we were saying. And that wasn't because we were particularly clever. It was because we were listening to the scientists. We were trying to understand as much as we could what different scientists were saying, a range of opinions, but SAGE telling the government to have a circuit break, SAGE saying that rotas in secondary schools, in schools in general, would reduce the amount of transmission by a significant degree. We were listening to scientists. And then I know that so many of you will have worked throughout the autumn term, making sure that as many CEV people were at home for as much of that time as you could get with your head teacher, of making sure the checklists were in place, and then that moment in January. And maybe we know some more about that now. From these allegations that the Prime Minister was saying that he would rather have bodies piled up than another lockdown. And that moment on January the 3rd and in the run up to January the 3rd, when we had seen the minutes from SAGE from the 18th of December saying that they couldn't be certain with the new variant that the R rate would be below 1 if schools were open, and they were still the Prime Minister and Gavin Williamson saying all primary schools opening on January the 4th, in that meeting, that contribution that he made on the Mar show, the Prime Minister, that day when he said that schools were safe. And then we had that huge response of 40,000 NEU members on a call on Sunday morning, with more than 100,000 people watching the whole of it on social media, and 400,000 people watching at least part of it, and then well over a quarter of our primary members sending their head teacher that day a letter saying that they were going to use their Section 44 rights because of what the Sage Minutes said in our presentation to them, and you working with your members to make sure that happened. And then the Prime Minister changing his mind after our meeting to the next day saying that schools were vectors of transmission. I tell you, we made a huge contribution. The data did not change between Sunday and Monday. The data was there all the time. Maybe he was thinking he would leave it a week and then close schools. It might have been something like that. But I think we forced his hand. Practically hardly any schools opened that were expected to open on that Monday. As a result, some did, but many were closed. And I think the government will have looked at that and thought, we cannot just let this get out of our control, where the NEU and Unison and teachers and support staff are making the decisions. And you made a huge contribution. We made a huge contribution to keeping people safe in this country when we took that stand together. Now, because we've done that, and because our fantastic National Health Service has run the vaccination programme, and because the vaccine scientists who were taught in our schools by our teachers, because they have a vaccine program in place, things might start to be things are starting to get better, and maybe we can see light at the end of the tunnel. The data today suggests that cases are still falling. I mean, Deepti will say more about these questions and the uncertainty about those figures in a little while, and I'm sure Janet will contribute to that as well. But at the moment, the ONS is saying cases are still falling. Certainly hospitalizations and deaths are still falling. That is good news. But we have to keep those trends going in the right direction. And that means that there is still lots of health and safety work and community safety work to do in our school settings. We have to make sure that ventilation is in place. We should keep mask wearing going. It has turned out not to be as difficult as some people anticipated, and it is making a contribution to stopping the spread of cases. I think we should be advocating the use of lateral flow tests. I don't know whether Deepti and Janet will agree with that or not as an alternative to isolation, but as finding some cases that would otherwise be missed. We need to still be saying no to in-person staff meetings and in-person parents meetings, because those will be the most dangerous point in your working life of the virus spreading, because it does spread faster between adults. So we should be saying no to that. We should be continuing to say that clinically extremely vulnerable people should stay at home until at least they've had their second vaccine and the buildup of antibodies after that second dose. They vaccinated clinically extremely vulnerable people at the same time as they vaccinated 70-year-olds, because they're at that sort of level of risk that is higher than everybody else in the school system. And we think those people should make their contribution working from home until we reach the point where at least where they've had the second vaccination. So ventilation, masks, keep social distancing to the extent that we can. And that means staff meetings, parents meetings should not be in person. CEV people being at home, support the question of the use of lateral flow tests to find some extra cases. And maybe we get through this. The NEU is working to support the vaccination effort as much as we can. So every time a new age group comes up ready for vaccination, we send an email to our members in that age group. So if you're 42 to 44, you should have got an email yesterday about your eligibility to now, in England at least, to go for a vaccine. We sent it to 44-year-olds on Monday when they became open. And we're also trying to deal with the bits of question about vaccine hesitancy, much lower in our country than in other countries. But we're working with the Stephen Hawking Foundation, and one of our members, a teacher, Ed Stubbs, in a school in East London, produced these materials for the Stephen Hawking Foundation, which allow children to ask questions about the vaccine. So we'd urge you as health and safety officers, as reps, to look at those materials and to suggest they are used in your school. Anything we can do to help address questions that people have about the vaccine is worth doing. Encouraging our members to get vaccinated is worth doing. We have to keep on top of the data, and we will be looking at the data every week, reporting on it. And our concern is that we'll see cases starting to rise again, leading from schools and then leading out into the rest of the community. We hope we're wrong. We hope that the pace of the spread of vaccination and the fact that we're heading towards the summer and ventilation is easier can keep cases falling down. But we are worried that cases will start increasing again. And if they do, we will be loud about talking about that and saying that every mitigation that we can have in place should be in place. Thank you for everything you've done as a health and safety officer or a workplace rep. We know that it has made a huge difference this year. And when we come out of COVID, there's a whole set of other health and safety questions that come up in schools, from asbestos to workplace stress. And we think health and safety is a really valuable way of thinking of all of those issues, a valuable tool in the armory of the union and its members at workplaces. So thank you very much again to Ian and the Health and Safety Off. Thank you for all of the work that you have done. You've kept people safe. Let's carry on with it.
Thanks very much, Kevin. Thanks for those kind words. I'm going to move swiftly on to Deepti. Deepti Gurdasani. Deepti's been working closely with the NEU and other trade unions in the fight against COVID. Deepti, it's great to see you again. You're very welcome.
Thanks for having me. Can I just share my screen if that's okay? Here we go. Can you see it?
Yep.
Yeah.
You can see that.
Great. So I just wanted to sort of summarize where we are in terms of, I guess, infection rates in the UK and, the impact of school openings and Easter break, and then go on to, some of the challenges we're facing at the moment. So, we all know that we've had one of the highest deaths rate within the UK. So over 150,000 deaths now linked to COVID. We have more than 1 million people estimated to be living with long COVID. And although transmission appears to be declining, the number of daily confirmed cases is still around 2,000 per day. So, it's definitely not as high as it was at the peak, but it's not as low as we'd like it to be either.
Absolutely.
One of the things that we've seen throughout this, and we're very lucky to have the Office for National Statistics data, because it is one of the few unbiased sources of data on children, in that, we survey the general population. So it's not dependent on children, for example, having symptoms, because we know that children are less likely to be symptomatic and less likely to test. So it's a random sample of the population that gives us an idea of infection children in a way that we cannot get through most of the data that comes through Public Health England. And one of the things that we see is every time schools have opened within England, we've seen a sharp rise in infection. So if you think of the red line as sort of younger children, primary school children, and the orange line as secondary school children, we consistently see infection positivity track school openings and closures. So for example, here we see after half-term infections go down, and once schools open, even during lockdown, infections don't drop as much as in other age groups, and then continue to rise. And you can see here, for example, that once schools closed, the infection in other age groups peaked only after infection children peaked, suggesting that school school-age children really do drive community transmission. And it's really interesting that even once we went into lockdown and, we started, January, and I think schools were open for one day, and after that they closed, we still see infections in primary age, school-age children go up, which sort of tracks the higher number of children who are attending school at that point in time in primary school. So we know about 1 in 4 children were attending school in primary. So you see that increase there, but not so much in secondaries, where only about 5% of children were attending. So not only does it track school openings and closures, you see a very close correlation with the level of attendance in schools as well. Once again, want to highlight, this is the sort of data that most researchers tend to look at from Public Health England to draw conclusions that there's not much transmission happening. And this is symptom-based testing. And here you can see, although in the previous graph, you can see that infections in these age groups were the highest just ahead of Christmas when schools closed. That isn't apparent here at all because these data are very biased. And sadly, this is the data that's often quoted to suggest that children aren't contributing to transmission. So where are we now? So I think, as Kevin said, infection rates are coming down, and that's very good. But I think that doesn't sort of reflect the full picture, because we need to look at the very short period of time that schools were open prior to Easter. And you see impact of that on R, which is the rate of decline of the pandemic, in all the regions where schools were open. And you see it probably more prominently in Scotland, where schools were open earlier on, although in a staggered way, so just for primaries. But you also see that in England. So you can see there was a sharp decline, plateauing of infection as per the Office for National Statistics data, and declines resumed again when we started Easter break. Similar pattern with Northern Ireland and Scotland, who also did the same. Wales was a lot more cautious with school openings, with only very young children returning to school, I think in March, and on 15th of March, I think they expanded to P1 to P3. So there was very little time before Easter break started. So we don't see the same pattern. And of course, if you break this pattern down by age group in England, for example, you can clearly see that very rapid rises in infection in primary school children and slower rises in secondary school children, who had the highest infection rates across all age groups just ahead of Easter break. And you see that declines, very sharp declines after Easter break. And so this is the raw data from the Office for National Statistics modeling that I've pulled out. And once again, this is when schools open in England. This is primary school and this is secondary school. One thing that's really worth highlighting here is, in the past, generally we've seen secondary school infections being higher than primary school infections, although both show increases with school openings. Here we see a slightly dampened impact on secondary schools, although there is clearly an increase. And I wonder whether that's related to the recent policy of mask wearing, or rapid testing. It's hard to kind of, tease those out. But it's very clear that we need more mitigations in schools in all settings, primary and secondary, not less. What I find interesting here is there isn't just a rise in school-age children, it's sort of reflected in the community as well. So you see a rise in young adults and also declines in plateaus of young adults, which could potentially reflect those sort of infections going into parents. Of course, a lot of people might say, so what is the problem with that? Children don't get sick. That's a myth. Children do get sick. We know that there are many children. So approximately 43,000 estimated children are living with long COVID. Many of them have debilitating disease, which influences their day-to-day activity. If you look at the proportion of children who develop persistent symptoms lasting 5 or more weeks, it's between 10% to 13% of everyone who gets infected, irrespective of whether it's mild or asymptomatic. These are not children who are hospitalized. These are just people we're living with in the community. So that's quite a large number. And if you look at the numbers who develop even longer duration of symptoms, 7 to 8% of every child that gets infected goes on to develop symptoms for 12 or more weeks. And remember that the Office for National Statistics has only looked at about 12 symptoms. Actually, in the studies we've done, we know that there are many, many more symptoms of long COVID. And if you expand that definition, you would possibly identify many more children suffering with this. And of course, we know about 110,000 teachers have been affected, sadly, with long COVID, are estimated to be living with long COVID, many of whom have impacts on their day-to-day activity and were young and healthy prior to this. The other is, there are many, many studies now that show that infection from children leads to a higher risk in parents. So this is a huge study within the UK, the Open Safety study, that showed not only a higher risk of infection among parents of children of all age groups, but also an increased risk of hospital admission in these age groups. And this is despite the fact that parents were less likely to die of other causes than non-parents, suggesting that there are differences in that parents seem to be healthier than non-parents for other reasons. And despite that, despite this being a possibly healthier group, they are much more at risk of infection and hospital admission. Similar study from Denmark of over about 500,000 people showing increased risk in parents, also increasing with the number of children in a household. And of course, this is children of both primary and secondary school age groups. Teachers are unfortunately also at high risk. Studies from Sweden show that in-person teaching at one point in time was associated with 2 times the risk of teachers who are undertaking this compared to teachers who were undertaking remote teaching at the same point in time. Apart from the risk to the wider community, parents and teachers, there's also a risk of spread of new variants. We actually know that it's really worrying that in the UK, we're seeing week-on-week spread of new variants of concern that could potentially impact vaccine effectiveness. So I've heard now of 3 outbreaks in the last few weeks in different parts of the UK of different variants of concern, the so-called South Africa variant, the Indian variant, and the B117 with variant which has a particular mutation that's similar to those other variants. So the big question is, do mitigatory measures help? They do. This is a very large study from the US of around 500,000 people, again, looking at parents and showing that, parents of children in in-person schooling have a higher risk of infection. And you can see, again, this is for all age groups. And this can be mitigated. So looking at schools with different numbers of mitigation measures. So this is 0 mitigation measures or 10 plus mitigation measures. And these were the mitigation measures looked at. You can see masking was one of the most common mitigations studied here. And you can see there's a decline in risk in parents, which reaches baseline if you are able to mitigate, but it doesn't require one measure. It requires multiple measures. And masking is one of the important ones. So this is an article I saw in the BBC today, and I keep seeing articles about how lockdown, school closures hugely impact the mental health of children. What I find really paradoxical is that often people who write these articles and talk about this never mention why lockdowns and school closures have occurred in the first place. They've essentially occurred because our politicians and our scientists have denied that there is a link between schools and community transmission. So we haven't put mitigations in place. We don't just need to open schools, we need to keep them open. And the best way to do that and prevent lockdowns and school closures is to mitigate within schools. And that's the best way to prevent these harms to children that everyone's concerned about. So how do we make schools safer? I think, Kevin mentioned there needs to be a lot more focus on aerosol transmission, which we still haven't got a handle on in the UK. Face coverings, ventilation, smaller class sizes, smaller bubble sizes. When children get sick, it's not just, their close contacts physically who need to isolate. It has to be the whole bubble because, that's how aerosol transmission happens. Physical distancing. And of course, looking again at our vaccine policy, and lateral flow tests, and I'll talk about this in a bit more detail, but we need a multi-layered strategy with all these measures in place to protect everyone. And of course, keeping our community transmission low is the backbone of it. But unfortunately, where we are now is that the Department for Education, despite clear evidence that prior to Easter, infections in schools and the community, schools were rising and the community were plateauing, and after Easter, are reduced and infections should reduced. Despite that, the Department for Education is considering removing masks from schools. And this is very paradoxical because they carried out a review which was published on the 6th of April where they said, masks reduce transmission, protect children and other people, and they should be continued. We have almost no evidence that has emerged since then because schools have been open for such a short period for them to have reversed this stance. So it's very hard to understand that a government that's really focused on following data and not dates is talking about removing a policy that they only a few weeks ago during Easter break said was very important when we have no data since then to change that stance. And of course, we've also hearing about these troubling, or at least I find them troubling, lateral flow test trials to replace quarantine. So lateral flow tests, I think, are a very important tool to identify new infections with certain caveats. They are very specific tests. They're not very sensitive tests, so they're not very accurate picking up infections. But if they're positive, then it's highly likely that you may be infected. Of course, we do confirm with PCR to ensure that. They're good red light tests. So if you identify new infections, you can stop chains of transmission among children who are asymptomatic before they infect others, and that's a good thing. But using them to replace quarantine is not how they were intended. They're not green light tests, so they can't be used to determine that you're not infected and essentially let you back into the classroom when you've been exposed to somebody who's infected, because then you're at high risk. And the MHRA, which is our medicine and health regulatory body that regulates these sort of devices and tests, very recently issued a statement saying that there is a problem with the way they're being used in the UK, and they should not be used as green light tests. This is also out of line with CDC recommendations that explicitly says that they should not be used like this. It's also very concerning that they're being used without consent from entire bubbles and household members, because if a child who tests negative with an LFT goes back into a classroom and is infected and infectious, they can possibly infect others as well. So why aren't other people at risk, like staff or other children and their household members, being asked to consent? Of course, the government has based this on one particular model, so it's not real world evidence, it's actually just a mathematical model, but the assumptions in these models are very flawed. So actually the model says that LFTs are only equivalent to quarantine if the adherence to quarantine is much lower than the adherence to LFTs. In reality, that's very unlikely to be the case. We know when a child, when a child is infected in school and there's a contact, they're let know by the school that they're a contact, and then they have to quarantine. I mean, there isn't very much choice in the matter. So, I would think that adherence with quarantine is quite high, although, I think this particular study assumed around 50%, which seems really, really low to me in that setting. And, the assumption is that LFTs would have 20% higher adherence, and that would make them somewhat equivalent. And I think that's a very flawed assumption. Of course, if you have equal compliance with both, then LFTs are always inferior to quarantine, and that's what the model shows. And of course, these also assume that although LFTs are not accurate in picking up infections, they're very good at picking up infectiousness. In truth, the studies that have looked at this don't have the same amount of optimism that it would pick up infectiousness either. And the studies are very inconsistent about whether these would even pick up all people with high virus loads and how that correlates with infectiousness. So I think there are many problems. What I find really worrying also is, having read the participant information sheets that have been shared with me with parents, there's no mention of insurance or liability. And as a researcher who's done many studies, it's required to mention that. I wouldn't get a study pass ethics approval if I didn't mention that. So it's very unclear to me that if somebody contracts long COVID as a result of the trial, or very sadly gets hospitalized or even dies, what are the arrangements for compensation for that, and who's responsible? I also want to mention one thing about LFTs. While I think LFTs are useful in asymptomatic testing of children and parents, I do want to say that in the UK right now, 3 out of 4 people with symptoms are not coming forward for testing because they don't have the ability to isolate, because the UK has the lowest sick pay across all of the OECD. In that setting, I honestly don't feel that many parents will come forward for lateral flow testing, for asymptomatic testing, unless the government does something about sick pay and isolation pay. So it puzzles me that the government has put in hundreds of billions into this project of LFTs without actually supporting the back end, which is isolation. Of course, I keep hearing, but vaccines. About 19% of our population is now fully vaccinated. About, I think, 50% or more have received 1 dose. So this is a report from Israel that came out today, which has much higher rates of vaccination than us. So more than 50% of their population is fully vaccinated, and that's 80% of adults. And I want to point out that they've opened their schools only after 50% of the population has been fully vaccinated. And they are having, in the first week of school opening, 117 students who've been infected in 5 outbreaks of coronavirus. So yes, vaccines are great, but it doesn't mean that we can do away with all of the mitigations, particularly in the school environment where most people aren't vaccinated. Yeah, so I'm just going to end there. I'm very happy to take questions.
Thanks, Deepti. That's absolutely brilliant. We're trying to sort of collate questions in the Q&A function,
Sure.
and I know there's lots of other messages
Yeah.
that have been posted in there as well. We don't have the chat on, so colleagues on the call, please have a look in there, use that function, and we'll come back to you on that, Deepti. So much powerful information there. Thank you very much for that. Before we move on to Janet, we are going to see a short video montage now, a collection of short messages from some of our brilliant health and safety reps. If we can tee that up now, that'd be great.
Hi, my name's Paula and I'm a health and safety rep in Bury. I work for an academy. We had a bit of an issue at the start of lockdown when our head teacher wanted all members of staff to come into school every day to deliver our online learning. So we organised a meeting. We've got nearly 60 members and 43 members attended the meeting, and of that 35 signed the Section 44 letter. After that, the head then changed her mind, and the trust then said, yes, we could come in on a rota and work from home if we wanted to. So I feel that with dialogue and working collectively, we can make a difference and improve health and safety in schools.
Hi, I'm Scott Lyons. I'm a health and safety rep and health and safety officer in Norfolk. The pandemic has brought a load of new challenges, but what doesn't change is the health and safety legislation that protects us all. One thing that we successfully did in our schools, that the health and safety group met, and we decided that the COVID risk assessment was more of a management tool, a kind of checklist, and we wanted to see a proper RAG-rated COVID risk assessment. We managed to get that in place. It's such a relief to all our members to actually see what the dangers were and what was actually being done, and we could track and assess this. Such important work, keeping people alive in school. Keep up the great work you do. Bye.
Hello, I'm Hema Dahale. I'm an NEU health and safety rep in Roebury Infant School. Following the NEU's big drive of keeping schools well ventilated and the wearing of face coverings, we have managed to do exactly that to keep all of us safe. This has been possible due to a collaborative effort in having a robust risk assessment in place and keeping it under a weekly review. Thank you.
Hi, my name is Rachel Headley and I work at our school. My big win was with Parents' Evening. We went from having a 2-hour parents' evening in the hall to having 2 nights of 2-hour parents' evenings on consecutive nights due to COVID. After speaking to the head, we then addressed this and the head arranged for a survey to be sent out. Prior to this, there was a set break in the middle of the parents' evening that nobody could move. This meant that some people were not able to go home for parents' evening and had to stay 2 consecutive nights in school to deliver parents' evening. From the survey, it was changed to a 3-hour slot on one night, with the break being able to be placed wherever the teacher wanted. This was a great win for staff and boosted morale in the school.
Hello, my name is Gerda Palenda and I'm a health and safety rep at Oliver Goldsmith Primary School. After the second lockdown, our LSAs had to ensure the provision for the key worker bubbles. They shared their concerns in regards to increased responsibilities, workload, and amount of time spent at school. So we took their concerns to the head teacher and we reached a very speedy outcome, which was new rotas put in place, additional staff was hired to help to accommodate that, and everyone felt much relieved and less stressed.
Hello there, I'm Ryan Atkins. I am a health and safety rep at a primary school in Coventry. It's been a very busy year, I'm sure all health and safety reps will agree. In my school, I have helped set up a health and safety committee that have looked at health and safety across the school, and a specific COVID-19 health and safety group, which has been fantastic, and it's enabled me to liaise with the head teacher and senior leadership team within the school, ensuring that everything is safe. Keep working out there, health and safety reps, you are doing absolutely fantastic.
I couldn't have said it better myself. They certainly are doing absolutely fantastic. Those videos are brilliant. Thanks for everybody for recording those, and thanks to everybody else that sent in videos that didn't make the final cut. We couldn't fit you all in, but superb to see those. Thanks very much. We're going to move on to our next speaker now, our final speaker, and Janet Newsham. She'll be familiar to lots of you. Janet's the chair of the Hazards Campaign Group. Janet, you're very welcome.
Thank you very much for inviting me to speak at this important event and on this important day for health and safety. International Workers' Memorial Day is a day when we remember all those who've been killed because of work, and never has the role of safety reps been more crucial than over the last 12 months. Organised and active trade unions and their safety reps have saved literally thousands of lives. And I commend all the NEU safety reps for the vital role that you've undertaken this year. On this day, we remember with heartache all of those workers killed in work-related incidents because of exposures to chemicals and hazardous substances, toxic working practices, and infectious disease. We remember those killed in incidents because of their work at sea, in air crashes, those killed on the roads and on railways, and we also remember those who died because of work-related suicide. This year, we unify in our grief for the thousands who have died from COVID-19 and share our despair and anger. And as we remember the dead on International Workers' Memorial Day, we pledge to fight for the living. Everyone should have the basic human right, the fundamental right to safe and healthy work in whatever job we do. And the pandemic year has illustrated how all jobs, all work and all sectors can be dangerous if the risks to our health and safety are not controlled. They have shown that without proper enforcement, many of our employers fail in their duty of care, fail to ensure the mental and physical health of those affected by their work activities. This year has shown how little neoliberal governments prioritise workers' health before profits. Prior to the pandemic, the Hazards Campaign has been calling out the UK government's negligence of workers' health and safety, the deregulation agenda, and the political dogma of undermining the enforcement bodies responsible for ensuring that employers prevent harm. As Rory O'Neill says in the Hazards Campaign, the pandemic didn't cause the occupational health crisis, it exposed it. Hundreds of thousands of workers have found themselves at the epicentre of a workplace catastrophe. Not just those in high-risk employment, but those who now became at risk because they were needed to continue to work to provide support, healthcare and other essential services, including education, to keep others safe. It has been clear that we cannot trust the UK government or employers to control the risks to our health and safety. And the Health and Safety Executive haven't protected workers and have put public health and workers' health, and public health is workers' health, and workers' health is public health. They've increased risks in workplaces, spread viruses to our families and to our communities. Leicester's sweatshops was an early example of how that spread into the community, the food and meat processing plants, but also recently the DVLA and the call centres in Swansea, where the infection rates skyrocketed to over 600 before Christmas and went into their communities. and as a result, at least one worker is dead. But we don't know about the families because there's no investigation of where the infections have gone to. So it could be families and community members who have died as a result of that. But we do know that long COVID will be the result for many of those workers. Whilst other countries move to increase the important role of health and safety of workers and their representatives by providing platforms for them to speak, report concerns and ensure that they are working in safe and healthy conditions, the UK government opened its propaganda machines and continued on its belligerent path to Brexit and undermined the safety and health of essential workers. Workers on the front line exposed without adequate controls of the risks and dying in their thousands. The government's path has been economy above health, and now with a final push to open up the economy, we are again on the verge of a wave of more deaths and illness. What's clear to the Hazards campaign is that without the heroic role of trade unions during this last year, many more would be dead. Many more workers and their families and friends disabled and left with long-term ill health. The Hazards campaign continues to challenge the government, employers and enforcers view that schools are something different than a workplace. A workplace that needs to be put in place, we need to put in place a suitable and sufficient risk assessment using a control hierarchy approach, that they create bubbles of dozens, if not hundreds, and that won't impact on the health of staff, children, young people, parents, their families and community. It flies in the face of logic and reality. Safety reps have continued to challenge employers denying reps to the risk assessment reviews or even risk assessments, denying them information about infections and even saying it's illegal for them to share that information with reps. Employers not putting in place the basic controls needed as new information became available about the transmission routes of infection. Actually, it was months ago when we knew that there was airborne, the risk of transmission was airborne and the need to improve ventilation was essential and critical. Such as the need, and continuing the need for less people and for less time, physical distancing, enhanced cleaning, working from home if possible, to continue improved hygiene, one-way systems, and above all, a proper precautionary standard of PPE. And I know we talk about face coverings for students, but lots of other countries are looking at FFP2 minimum standards for all indoor settings for all citizens, not just for workers, but all citizens. And I think that's what we should be demanding. We need a proper precautionary approach until we know for sure that the virus is out of our workplaces and out of our communities. With the introduction of workplace testing and vaccination, governments and employers are continuing to ignore the risks and are burying their heads in the sand while the virus continues to circulate and kill. Testing and vaccinations are just another mitigation in the list necessary to protect us all. And all other mitigations must stand until we're in a much safer place in our communities. The government's roadmap is full of dead ends, literally. We have to continue to fight for our employers to carry out their legal duty on health and safety and to take a precautionary approach to controlling transmission risk in all our workplace settings. Schools are no different than any other workplace. The virus doesn't respect education, children, or classroom doors. Everyone can be infected, infectious, and many of all ages, and many children of all ages will be left with long COVID, and sadly, some will die. We have to ensure that those control measures that are needed to control the transmission of the virus in our workplaces are kept in place. We need more safety reps. And I think the fantastic work the NEU have done in recruiting safety reps has been brilliant and exemplary. We have to hold our employers to account to their legal duties. It should be them in the docks if people are killed, injured or made ill by work, and it will be them. But we need to ensure that they're preventing both the mental and physical ill health of people by their work activities. So holding them to account for making sure that they're controlling the risk to our mental health as well as their physical health. For too long, teachers have put their lives at risk to protect the savages of the effects of cuts on children and young people they educate. We know now that without adequate health and safety, then the consequences in all our workplaces can be lethal. So on International Workers' Memorial Day, I want to leave you with this. Donna Coleman died after COVID-19 ran riot at Burnley College, aged 42, on the 6th of January. She and her family knew that her employer wasn't controlling the risks to her and her colleagues' health, but she was too worried about how her employer would react if they found out she had reported them. But her full-time official did report their concerns, and the HSC still failed to enforce the law. In her last text messages from her hospital bed, she sent messages to friends and family. Her sister pleaded with her to keep fighting, but she didn't have the strength to fight anymore, and her last message to her sister was, "I love you more." Her family wants someone to be held accountable. We should all demand justice for her death and others. So when your employer says we need to get back to normal, we don't need to control the risks any longer. We have to fight back, hold them to account to health and safety law. It is their duty, the employer's legal duty, to ensure the physical and mental health of workers, and your right as a safety rep to challenge employers that they are doing it wrong, that they're not controlling the risks. It must be the fundamental right of all workers to have safe and healthy work. It has been collective action that has protected workers and not the benevolence of employers. Actions like the ones that the NEU took, the examples that are given in your videos, the actions that it took on unsafe workplaces, actions like other unions have taken and are taking. We are at a moment to force change on our enforcement authorities and to enforce the employer's legal duties to revise their stance that COVID is serious and not a significant disease. We are at that moment when we need to stop infections and deaths, when we need to come together with sister trade unions and fight for the right to safety. On April the 28th, 2021, International Workers' Memorial Day, together with workers across the world and the UK, we remember with heartache our dead, and we pledge to fight like hell for the living in a global action for change, for the fundamental right for all workers to safe and healthy work. Thank you.
Thanks, Janet. Incredibly powerful words, and thanks for drawing attention to the appalling story about Donna Coleman. I know there's a link in the Q&A about that. And thanks also for drawing attention to the vital importance of health and safety reps. It's an acknowledged and evidenced fact before and during the pandemic that schools and colleges and other workplaces with health and safety reps and safety committees are safer. If you're watching this now live or perhaps later, and if you're not one already, please consider volunteering to become a health and safety rep in your school or college. We've got brilliant online training available until we can do the face-to-face stuff, and details will either be in the Q&A and chat or we can get that to you. It's perhaps the greatest and most powerful thing that you could do to mark International Workers' Memorial Day for this year. I'd like to thank our speakers again, Kevin, Deepti and Janet, for all their brilliant contributions, and also again huge thanks and respect to all our existing health and safety reps, COVID reps, advisors, organising forum members, district and branch officers and staff whose safety work and campaigning this year has undoubtedly saved many lives. At the end of this call, colleagues will see an important do's and don'ts poster as a backdrop. We know these posters and messages make a difference, and we'd like to see them, we need to see them in every single education workplace in the country. To that end, extra copies have been printed and are available on request. Details, I'm sure, will be sent out, perhaps in the e-bulletin on Friday, if not before. Also, just before we finish, huge thanks to Sarah, Jono, Monica and Patrick and the other officers and tech team for making tonight possible. And I would like to close and just mark the end of this important meeting. It's been, I'm really proud to have chaired it with a minute's silence. And thanks to everybody for taking part. And if we could put the poster backdrop up and start the minute's silence, thanks to everybody. Thanks very much. Thanks very much, everybody. Hope to see you again soon. Thank you.